COVID-19 cases have been surging in Texas and nationally, mostly among unvaccinated people, as the highly contagious Delta variant has become the dominant strain in the U.S. Hi, I'm Karen Brooks Harper. I'm the Health and Human Services reporter for the Texas Tribune. I cover the pandemic and the vaccine. Just about every metric related to the coronavirus has gone up in Texas in the last several weeks, especially. Hospitalizations for COVID have increased almost fivefold. Average new cases are going up dramatically. In some markets, they've increased fourfold. Our new deaths are starting to tick up. And at the same time, vaccinations are starting to tick up. And health officials believe that is because of the increased hospitalizations and the news of this highly transmissible Delta variant. So just about every number we have associated with the coronavirus is climbing, which is really not the direction we thought we'd be going at the end of July. We can say with confidence that the Delta variant is widely viewed as the fire behind this latest wave. When we look at how people can stay safe from the Delta variant, there are several strategies that the health officials on the local, state, and national level are advising us to do. So far, they aren't mandatory in Texas, as per our Governor Greg Abbott has declined to make any of them mandatory or let local governments make them mandatory yet. But masking up is the way that health officials are saying to stop this surge that they believe is coming in its tracks. You know, if you get vaccinated right now, the least it would take is 2 weeks if you get the Johnson & Johnson one shot, and up to 6 weeks if you get one of the others to be fully vaccinated and fully protected. So that's not going to stop, what we're seeing is this doubling and tripling of these numbers in some of these areas and hospitals. However, with the masking and social distancing and guidelines like that, that's things we were doing in October, things we were doing last June, those things can stop this hospitalization and case transmission rate fairly quickly if everybody does that. Vaccination is the end game. It's the long term. It's something that needs to happen now, according to the health officials, to stave off future tragedy coming around the corner. We have information from some forecasters at several universities here in Texas that say that if absolutely nothing changes, if we continue our behavior today with no masks and social and everything open and that kind of thing, we could reach January hospitalization levels before school opens. The smartest minds in the country and in the world in the medical profession tell us that the vaccines are still very safe, very effective against all strains, including the Delta. And even if it's more transmissible among vaccinated people, it is still the vaccine is still highly effective at keeping people out of the hospital and even more effective at keeping them from dying from the virus. So the good news about vaccinations is that they are starting to tick up. So that is a hopeful sign for the distant future. For the very near future, the masking and social distance protocols are, experts say, the way to go to stem this new variant.